Namaste Vidya. Hamesha khush raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homeopathic Science, in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the radiological and renal imaging, especially blood biochemistry, urogenital system. Whenever a patient of renal system is coming to you, what are the various radiological and renal imaging that you are going to perform? We are going to study about these things today. So there are various radiological investigations that are needed to be done whenever a patient is coming to us for the diagnosis of renal diseases. So first of all, the basic investigation, most important and most common investigation is plain radiograph of abdomen, that is X-ray abdomen. So this is done to detect any kind of radiopaque stones, especially in case of nephrolithiasis or fecolith. So especially if you are talking about kidney disease, then nephrolithiasis is the most common cause, or obstruction, renal obstruction due to any kind of stone that is needed to be diagnosed by doing a plain X-ray, a plain radiograph. So this is the most important and most common investigation, radiological investigation that is done in case of renal disease diagnosis. The second most important the most common investigation is the ultrasonography or the USG. USG or ultrasound is a very quick, non-invasive, inexpensive and harmless method that is employed for the diagnosis of any kind of renal disease. To assess the renal shape, now following things are assessed by doing the ultrasonography or ultrasound. We assess the renal size, shape, position and thickness of the renal cortex. So we are assessing the renal size, renal shape, renal position and the thickness of the renal cortex. To detect the solid tumors and their extension, the cyst and polycystic disease, the stones and calculi, dilatation of the pelvic calicine system and hematomas. So first important thing was doing plain radiograph, that is plain X-ray. Second important radiological investigation is the ultrasonography, that is used to assess renal shape, size, position, thickness of the renal cortex and to detect any kind of solid tumors and their extensions, any kind of cyst, polycystic kidney disease, stones and calculi, the dilatation of the pelvic calicine system and the hematomas. To evaluate the residual urine volume and to detect the bladder neck obstruction or enlargement of the prostate. Fourth is to carry out certain procedures such as cystic puncture and renal biopsy. Ultrasound is essential. And last one is to detect the metastasis from renal carcinoma into the lymph nodes of the liver and to the lymph nodes. So ultrasound is having multiple purposes: to evaluate the residual volume, to carry out certain procedures such as cyst puncture and renal biopsy, and to detect the metastasis from the renal carcinoma into the lymph nodes and the liver. Next important investigation is the intravenous pyelography. IVP, intravenous pyelography, is done by injecting a radio-opaque material and following its concentration and excretion through the kidneys. So IVP, what is done in IVP is dye is injected in the blood circulation, and then the repeated film, as the dye filters through the kidney, the various radiographs are taken or X-rays are taken to check for any kind of abnormality in the renal system. The dye is radio-opaque and hence it is seen as a dark shadow. To see for any kind of obstruction, narrowing, etc. or carcinoma can be seen by doing the intravenous pyelography. Next important investigation is the micturating cystogram. What is done in this is done in children to reveal any kind of bladder outflow tract and to find out vesico-ureteric reflex. So micturating cystogram is a very important diagnostic feature, especially in case of children, to reveal the abnormalities in the bladder outflow tract and to find out the vesico-ureteric reflex. Next is the renal angiogram, to visualize the arteries of the renal system. This is used to demonstrate the anatomy of the renal arterial tree, to check for any kind of obstruction, or any kind of disease in the blood circulation or the artery system of the kidneys. It's for any kind of aneurysm or blockage or any other thing. Next important thing is the CT, that is computerized tomography or the CT scan. This is done to detect the masses and cysts in and around the kidney. So CT scan is another important diagnostic feature that is done these days for detection of any kind of masses, cyst, or any abdominal malignancy, especially related to the kidney system disease. Next is the radionuclide studies. These are carried out by injecting radioactive compounds and which are concentrated and excreted by the kidneys. Next is the renal biopsy. So renal biopsy, when we cannot reach at any particular diagnosis, and especially in case of nephrotic syndrome, renal biopsy is very much essential. It is performed percutaneously by needle. The name of the needle is JV'n needle or a true cut needle. This is useful for diagnosis of the patients with proteinuria, especially in case of nephrotic or nephritic syndrome of unknown origin. And I will explain renal failure with normal sized kidneys and in systemic diseases that are associated with abnormal urinary constituents. So renal biopsy is done percutaneously by a needle that is known as JV'n needle or true cut needle that is useful for the diagnosis of patients with proteinuria of unknown origin, unexplained renal failure, normal sized kidneys, and systemic disease that are associated with abnormal urinary constituents. So this was all about the diagnostic features or the radiological investigations that are done for the diagnosis of renal disease. In the next lecture, we are going to discuss about examination, manual examination of the male genitalia. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.